NMMC Quality Policy. NMMC is a premier healthcare service, training, and research institution in Northern Mindanao that envisions to be a leader in providing a holistic, quality, and affordable healthcare service for all. We are committed to provide the highest standard of care in compliance with the standard requirements by continually improving our management system. We guarantee patient satisfaction by treating patients with utmost dignity and compassion by competent and highly qualified healthcare providers in a safe and secure environment.
Welcome to the online graduation ceremonies of the Northern Mindanao Medical Center Resident Physicians of Batch 2020. Let us hear a message from the Medical Center Chief, Dr. Jose C. Chan.
To the resident graduates of this institution, as you continue the journey of becoming full-fledged specialists in your respective disciplines, may everything that Northern Mindanao Medical Center taught you be a motivating guide in your future practice of different specialties that you endeavor. You have endured 3 to 5 years of service and training in this hospital, and you met and encountered people and mentors who have guided you and mentored you in every single step of the way. Being at NMMC was not an easy feat. You were burdened with tons of work, especially in these COVID-19 times, and have given your medical or training and assistance and services to the people, to the patients of all walks of life, especially the poorest of the poor. I'm very much thankful to the services and the training that you have imbibed from this institution. It was really a challenging year for us and for the whole world, especially in these COVID-19 times. It still lurks in every corner of the world. But we were unfazed. We continually provide service, especially to those who were actually infected by the virus. And with all of you around, despite the pandemic, it warms my heart that you heeded the call to give service to this institution despite the potential risk the virus possesses. I am very grateful for each one of you. I hope and pray that you will become doctors imbued with compassion and ready to provide the medical services to every person in whatever background. God bless you all, and congratulations.
At this juncture, let us hear an inspirational message from the Chief Medical Professional Staff, Dr. Ramon F. Moreno.
To the graduates of the various training programs of Northern Mindanao Medical Center, to their parents and loved ones and mentors, may I thank Dr. Juan Miguel Nelias, your President of the Residents Association, for giving me this opportunity to share my thoughts on this momentous event of your graduation. Firstly, please accept my heartfelt gratitude for the services you have rendered to the numerous patients you have managed and cured at our hospital. And here I take this time to thank you on their behalf. It is also fitting enough for you to realize and thank these patients, as they are the sources of your learning in your data gathering and physical examination skills, honing your surgical techniques, other specialized procedures, and complying the accreditation requirements. This is my singular message to you, dear graduates, as you venture onwards to your journey. Personal gain comes after you have given the dedicated and sincere service to your patients, and what really matters most in practice is patient satisfaction. There is no greater good than doing things for the welfare of the patient. Congratulations and my best wishes to you, dear graduates, and thank you too to all mentors of Northern Mindanao Medical Center.
Dr. Peter S. Kiawit, the Professional Education and Training Officer, will now give his message to the graduates.
Colleagues, families, and friends, it is my pleasure and great privilege to welcome you to the very first virtual Northern Mindanao Medical Center residency training program's graduation for the batch 2020. I congratulate all the graduates who have persevered the rigors of their training, as well as have exhibited their dedication to this profession in the midst of this present pandemic. I would like also to acknowledge the hard work of all the mentors, department chairs, training officers, and research coordinators. Without these personalities, quality training for these doctors would not be possible. Lastly, I would like to thank the graduates' families for their confidence in Northern Mindanao Medical Center as a good training ground for these doctors. Once again, welcome everyone.
This year's keynote speaker is an NMMC alumna and an active pulmonologist. Ladies and gentlemen, help me welcome Dr. Nichelle Jan M. Valmoria.
I shall begin with 5 sets of questions for which you will be given 5 seconds each to ponder and answer. Question 1. A farmer has 25 chickens and all but 5 die. How many are left? The answer is 5 because all but 5 chickens died. Next question. If there are 3 apples and you take away 2, how many do you have? The answer is 2 because although there were 3 apples, you only took away 2. Question 3. Before Mount Everest was discovered, what was the highest mountain in the world? The answer is Mount Everest. Fourth question. If you were to put a coin in an empty bottle and then insert a cork into the neck, how could you remove the coin without taking out the cork or breaking the bottle? The answer is simply push the cork into the bottle and shake the coin out. Last question. The day before yesterday, Pedro was 20 years old. Next year, he will be 23. What day is Pedro's birthday? The answer is December 31. Considering this is the first time you've heard of these questions, how many did you get right? Are you like me who got 3 out of 5? Or are you one of the rare breed who got all the answers correctly? Well, congratulations! Apparently, you possess more common sense than us average mortals. A lovely morning to our esteemed guests, Dr. Jose Chan, Medical Center Chief, Dr. Ramon Moreno, Chief of Medical Professional Staff, Dr. Peter Kiawit, Chief of Professional Education and Training, Mrs. Sheila Mira, Chief Nurse, Ms. Aurelia Tacando, Administrative Officer, Mr. Mario Benedict Galon, Human Resource Management Officer. Same felicitations to our beloved chairpersons, training officers, and consultants and residents in training of each and every department who are with us online at the moment. Resounding salutations to perhaps the most important attendees of this first ever virtual graduation, the proud and relieved graduates of the different training programs of the Northern Mindanao Medical Center, together with their equally proud, relieved, and ecstatic parents, spouses, children, siblings, and other relatives up to the nth degree, and the close and the not so close friends. As a newbie with keynote speaking, I racked my pandemic-fatigued brain cells on what to talk about now. Contrary to what I first thought, I now absolutely refuse to talk anything about COVID or anything remotely related to any pandemic. Insert here a dozen crying emojis. It was just 2 nights ago when I decided to focus on common sense as the theme of this keynote speech. The questions that I presented at the beginning were some of the 50 common questions that examine the common sense of an individual. Well, that is according to the various online sources that I used as reference for this talk. I realized that there were easy questions like the ones on the 5 chickens, 2 apples, and Mount Everest. But there were other questions that had simple answers, but because of overthinking, I did not quite get the answer, like the one about the coin in the bottle and Pedro's birthday. Accordingly, common sense pertains to sound, practical judgment concerning everyday matters, or a basic ability to perceive, understand, and judge that is shared by or common to nearly all people and not necessarily on specialized knowledge. It means you need not have a PhD or even a degree in medicine to possess common sense and be adept at it. I can still vividly remember my parents admonishing my lack of sentido común despite my being a nurse and a doctor. Who among you have heard any of these explanations from someone else? Or perhaps said these words to another? Quote, "Bait man unta pero murag wala gigamit ang common sense." Or something like, "Aha, man tao nimo ang gibutang imong common sense ay." Or something like, "Punita imong common sense kay tamak-tamakan na sa log." IKR. Amazingly, and I just knew about this, there are two types of common sense, the good sense and the folk wisdom. The good sense can be described as the knack of seeing things as they are and doing things as they ought to be done. The second type is sometimes described as folk wisdom, signifying unreflective knowledge, not reliant to specialized training or deliberative thought. These two types are intertwined as a person who has common sense is in touch with the common sense ideas, which emerge from the lived experiences of those commonsensical enough to perceive them. Which of these types do you need improvement or which of these types do you have abundance of? What do you think? But I wonder if you've ever heard the adage that common sense is neither common or a sense. Voltaire was said to have quoted that common sense is not as common in the early 18th century. Indeed, contrary to its term, it may not be as common as we realize, because most of us are not as sound in judgment as we claim to be. If common sense is indeed common, then we may not be as eager to buy things we don't actually need every time Lazada or Shopee go into their monthly sale. Guilty. Or there may not be as indulgent in things like junk food, alcoholic beverages, and cigarettes. Or that we may not be as irresponsible and ignore minimal health standards like wearing a mask and a face shield and observing physical distancing and being in a crowded public area with COVID cases still on the rise. Not as common as we think, right? But how about common sense in the medical profession? How essential is common sense in the practice of medicine? Harvey Cushing, a renowned neurosurgeon and the first person to describe Cushing's disease, quoted that 3/5 of the practice of medicine depends on common sense, knowledge of people, and human relations. The following are 3 different scenarios exemplifying how common sense, if not applied judiciously in the practice of medicine, can bring about a resultant bad outcome. The first scenario is shared by Dr. Joseph Alpert, a professor in medicine in the University of Arizona. A 59-year-old man with a history of transient ischemic attack or stroke undergoes procedure that treats the diseased carotid artery. Hours after the procedure, he complains of chest pain. The ECG and the cardiac markers show that the patient is having a heart attack. The IM resident on duty initiates the following guideline-directed therapeutic protocol, including heparin, aspirin, metoprolol, lisinopril, and atorvastatin. The patient subsequently develops large hematoma or localized bleeding in the neck or at the surgical site and has to be taken urgently to the operating room. What happened? What went wrong? Well, this is an example of failure to use common sense in instituting guideline-directed therapy. Clearly, the heparin and the aspirin caused the patient to bleed, considering that the patient just had surgery. It is a scenario such as this that consultants imbue in their residents in training that guidelines are literally just guides. Common sense dictates that patients are managed according to the proper and individualized application of the given guidelines. According to Dr. Joseph Alpert, between the patient and the guidelines, there needs to be a doctor that is using his or her brain. However, this is easier said than done. This art of customizing the existing guidelines of each and every patient requires repeated exposure and experience to variegated cases and situations, to different patients, and to a diverse group of consultants. This is where the strength of the residency program is evident. This is the formation of a firm foundation from which will spring forth distinct yet common set of principles brought about by the unique experience each resident has had in the span of 3, 4, or 5 years of training in their respective fields. For the second scenario, a 33-year-old female noted a lump in her right breast the size of a marble. Gradually, it increased in size significantly in less than a year until her right breast began to be thrice as large as the left breast and has ulcers with foul-smelling discharges. It was only at this time that she finally sought consult at the surgery OPD. She verbalized that she did not seek consult or treatment because she feared of being diagnosed to have cancer. She consulted with their neighbor, who is neither a nurse or a doctor, and was told to go on to an albulario and take some famous herbal medicines with anti-cancer properties. After further workup in the hospital, it was found that she indeed has breast cancer and has already spread to the brain, liver, and bone. The patient died a month later. This scenario, or something similar to this, where patients listen and follow the orders of their neighbors or family, is a clear and present danger to our profession. Sometimes they go online and voraciously browse through the Google for any malady they have before coming into our clinics. There are even neighbors or family members who endorse or prescribe medications or herbal supplement that really worked miracles. Unbeknownst to the recipient of this neighborly advice, said medication or herbal supplement may actually be detrimental to his or her health, or may even be fatal. Such is the challenge to us doctors, as our common sense of being in the know and of being experts in this field has taken a beating should we have patients like this. Furthermore, we have to dispute what the patient thinks is a commonly sensible thing to do by following the advice of a seemingly knowledgeable and trusted friend or family. It is therefore of better judgment to counter this by establishing better rapport and gain the trust of our patients enough to supersede that of the neighbors or the family members. This will involve tactful and straightforward explanation to the patient of his or her illness and medications in the simplest terms possible that the patient can understand and relate to, with a whole lot of care and empathy that we can muster. We also need to have patience and the time to answer their queries, to allay their uncertainties. The third scenario is something that all doctors can relate. All of us are cognizant that lack of sleep, unhealthy food intake, and often sedentary lifestyle are bad combinations to health. All of us went through this phase from the time we entered medical school, where a 4-hour sleep is a luxury, where activities are spent sitting down and reading through chapters and chapters of medical books to make sure we get at least a passing grade, where we spend most of our time in isolation with so many family outings unattended. Sadly, this routine continues and actually gets worse into the residency and into the fellowship training, where we have a much more irregular sleep-wake cycle, sometimes only having an hour of sleep on a table or a chair while on a 24 to 36-hour duty. The feeling of floating, or a poor cerebral feedback because of lack of sleep poses great hazard to our common sense and can in turn affect our judgment in our daily interactions with other people and in the management of our patients. In general, our lifestyle as doctors are sometimes without common sense. It stems from our need for instant gratification, to reward ourselves after a long and toxic duty. After withstanding a litany of kasaba from the consultant, or after being able to finish our research. We often prefer to celebrate the small victories in our medical lives in the comfort of a bed, with the indulgence of delicious and often unhealthy food, while watching K-drama on Netflix. May this be on our own or with our loved ones. Most of us inherently know that this lifestyle, when not done in moderation and not tempered with adequate physical activities, are actually unfavorable to us. We know this practice seems to be a lack of sound judgment, but we tend to become blasé in the face of what we perceive as insurmountable stress that a residency or fellowship training entails. Indeed, most of us would appear to lack common sense, are simply because we intentionally or inadvertently fail to apply what we already know. According to the renowned author, Robert Ringer, common sense equates wisdom. It is the sound understanding of how life works. Since common sense is a product of wisdom, one takes away from individual experiences. It is a good definition of maturity. He says that another definition of maturity is the willingness to forgo instant gratification. It all comes down to experience, the wisdom one takes away from his experiences, and having the self-discipline to apply that wisdom to other situations. As I end this talk, I would open to you something beyond common sense because 1, it is not as common as it is. 2, it may have its own biases as it is primarily based on their unique experiences. And 3, it is something that can be altered to our whims and wants. Have you heard of reason sense? I was able to read through a narrative given by a Dr. Jim Taylor, a renowned psychologist, that alluded that instead of common sense, we should embrace this reason sense. This pertains to the sound judgment based on the rigorous study of an issue that actually includes personal experiences. Dr. Taylor said that even if we don't go into the rigors of full-blown scientific study for every topic we need to make a decision about, we can still apply the basic principles of the scientific methods informally. Dr. Taylor enumerated 4 steps in which we can engage in the more sensical thinking. The following are taken verbatimly from his narrative. First, we can begin our inquiry with an open mind, something sorely lacking in matters both trivial and substantial. Without being receptive to answers that we may not want to hear, we might as well just ask ourselves what we want to be true and go with that, which is what many people with so-called common sense do. Second, we all establish hypotheses that we would like to see affirmed when we are asking questions in our lives. But for hypotheses to be more than just foregone conclusions, it is important to propose alternative hypotheses. Just considering that there might be answers other than the ones we want ensures any experiment we conduct isn't just an exercise in self-serving affirmation, just like the drug trials done by the pharmaceutical companies. Third, we can collect a sizable sample of data that is more likely to be a representative of the population as a whole. So instead of just taking the few friends, their opinions on a topic which are likely similar to ours, we ask others, particularly those we know to have differing views. Does that guarantee sound judgment? Of course not. But does it make more likely that whatever conclusion is drawn will be closer to reality? Absolutely. Fourth, we can analyze the data as objectively as possible. Let's be realistic. No one likes to see their theories disproven. But there's a cynical saying in the sciences: if the facts don't fit the theory, throw out the facts. Also, don't forget the GIGO, garbage in, garbage out, which describes that the failures in human decision making due to faulty, incomplete, and imprecise data. The scientific method attempts to prevent both sayings from being realized by using statistical analysis that, at least in theory, don't allow for the intrusion of human biases. So the bottom line is, if there is a dispute with what is generally considered as common sense, we may need to put into play a more objective and reasonable ways to draw the most accurate conclusions and thus make the best possible decisions for the myriad of questions, concerns, and problems we may face every day, be they mundane or impactful. Once again, I send the most fervent congratulations and commendations to the graduates of the different training programs of the Northern Mindanao Medical Center of the year 2020. It is also with utmost gratitude that we send off these graduates who have shown great resilience, bravery, and diligence as being the foremost frontliners in our fight against COVID-19 pandemic. Thank you for your kind attention and good day.
Now we have reached the highlight of this event, presenting the graduates of the different residency training programs of the Northern Mindanao Medical Center Batch 2020.
From the Department of Internal Medicine, here are the graduates. Dr. Alhana A. Ayaon, Dr. Aliyah S. Mauyag, Dr. Ann Charis Makaibay, Dr. Gerard Adonis Superable, Dr. Hazel Claire Ang, Dr. Juraya Makil, Dr. Karen Ashley Ma, Dr. Naima Abdul Rahman, Dr. Siti Jamalia Epi, Dr. Siti Rokma Gubat. From the Department of Pediatrics, here are the graduates. Dr. Adelaini Abdila, Dr. Karen Debbie Guadalupe, Dr. Raihani Abdul Salam, Dr. Therese Joy Pulvera. From the Department of Obstetrics and Gynecology, here are the graduates. Dr. Georgina Gladys Labis, Dr. Novem Archie Braille Quijardo, Dr. Siti Malika Makadaag. From the Department of Surgery, here are the graduates. Dr. Edgar Sean Ray Inres, Dr. Ellie Cesar Veloso, Dr. Muhammad Sadiq Disumangko. From the Department of Anesthesiology, here are the graduates. Dr. Ernest Nicholson Tan, Dr. Potri Tumanina Ronsing. From the Department of Family and Community Medicine, here are the graduates. Dr. Abel Santini Permites, Dr. Rofeka Floro. From the Department of Orthopedics, here are the graduates. Dr. Al Monjid Lee, Dr. Joanne Lucenio. From the Department of Otorhinolaryngology, Head and Neck Surgery, here is the graduate, Dr. Larson Taruk. From the Department of Radiology, here are the graduates, Dr. Christian Silva, Dr. Ferdinand Bautista, Dr. Kenneth Flores Rubinas, Dr. Clement Sylvester Elizar, Dr. Olinor Mambuay, Dr. Samir Tahil. From the Department of Pathology, here are the graduates, Dr. Carlo Bienvenido Lugguban Jr., Dr. John Adrian Sakilayan.
To represent this year's ceremonies, let us hear a message from one of the graduates, Dr. Muhammad Sadiq Chito Disumangkop of the Department of Surgery.
Maayong adlaw sa tanan. I would like to take this opportunity to thank my mentors, our chairman, Dr. Simbulan, our training officer, Dr. Bailon, and my adored consultants, Dr. Chan, my colleagues, my parents, my siblings, and especially to my wife for their never-ending support on my journey as general surgery physician in Northern Mindanao Medical Center. Northern Mindanao Medical Center has been the second home for the last 7 years. I did my senior clerkship and postgraduate internship here in this institution, where I was in love with cutting specialization. It was love at first sight. After passing the PLE, I applied for 5 years of general surgery residency training in year 2016. Dr. Indres and Dr. Veloso are with me. We were really pushed to our limits during first year as surgical residents. We shed tears. There were moments when we just went home just to take a bath and go back to the hospital to assist in the OR. Do legwork by facilitating lab reports, blood products, monitoring critical patients, and making census. There were occasions when we even fell asleep inside the comfort room. Times when we can't even celebrate our own birthday or our wife's birthday because we have to attend to a patient or we have to be there for our senior residents. But what keeps us going amid this physical and emotional demand? It's because it is what we love to do. When we became second-year residents, we were assigned at the emergency room and started with our subspecialty rotations. At this point in our training, we get to meet different type of patients coming in and out of the emergency room. There were those with serious medical conditions. These are those patients who are involved in motor vehicular accidents. The pain all over person. These are the kind of people who make diagnosis quite difficult for us. Most of them tend to only be in pain when the doctor comes but act normally all the other times. The second opinion seeker, they go to the emergency room to be diagnosed again with the hope of receiving a different answer. The person who is diagnosed by Google and comes for medicine. The impatient patient, this is the patient with no serious medical issue but wants to be attended to first. The worried mother, and also the calm patient. This is the patient who will sit calmly for their turn to be treated. But despite these behaviors, we all treated them nicely because they came to our emergency room seeking for help. This was also the time where you get to meet the different types of residents from the other departments. There were those very friendly, those who were so intimidating to approach, and those who were angry all the time. Emergency room was also the battleground of brains for the different medical divisions. This is where they justify if the patients should be primarily managed by our service and not them. This is where we make new friends and probably short-lived enemies. But at the end of our duty, we all know that what we just wanted is what's best for our patient. At this point in our training, our commitment to become a surgeon has been checked again. There has been a point where we have just 8 surgical residents and we have to go on duty every other day for almost 2 months. But did that make us quit or make us all weak? No, because like I said, this is what we love to do. Confucius said once, choose a job you love and you're never going to have to work a day in your life. And I think this is true for my colleagues in the other departments as well. Another year passed quickly and then we were elevated as third-year surgical residents. And the other departments, they are now in their senior years. This was also the time that my senior clerks or postgraduate interns once began their residency training, and now some of them are graduating with me. Legwork was reduced, but the responsibility was growing. Managing of patients with more complex medical or surgical conditions. But to be able to treat these patients, one must have the knowledge, the skill, the confidence, and the talent to make good decisions. Because a bad decision could mean a dead patient. But for all the bad decisions that we make during our residency training, always remember that good decisions come from experience, and experience comes from making bad decisions. In our senior years, residency training becomes a lot tougher and harder. Responsibility is at its peak. Definitely, you'll be using a lot of brain cells during case presentation and in various conferences. And you have to be the most intelligent in the team. It's the time where you become team leaders. A failure of one team member is your failure as the team leader. Ito ang mga panahong palagi mong maririnig ang mga salitang, who's your senior? Ang pangurog, ang pagtulon-tulon sa laway, ang pag-ubo-ubo is real. But despite all that hardships and experiences, we still persevered and grow together to be better physicians. To the incoming residents in the year 2021, like us, you sacrificed a lot for the love of this profession. And just an advice coming from 7 years of my experience here at Northern Mindanao Medical Center. First, be organized. Prioritize that are most important. Second, ask for help when you need it. Your senior residents with more experience will feel valued and respected when asked their opinion. They will perceive this as maturity rather than weakness. Give yourself time to learn. The idea of residency is for you to get acquainted with a variety of methods and actually practice what you have learned. Don't be too hard on yourself and don't be afraid to ask questions. And lastly, love your job. As mentioned earlier, choose a job you love and you're never going to have to work a day in your life. Lastly, to our beloved Northern Mindanao Medical Center and all its staff who nurtured us, fed us with knowledge, good character, skills, and confidence. In behalf of the graduating residents of Class 2020, maraming salamat po.
Let us join together as we sing the DOH hymn.
Lahat tayo'y magkabuklod upang bayay itaguyod. Walang sawang maglilingkod sa nayon man o sa lungsod. Pilipino ang layunin, kapwa-tao'y tangkilikin. Pangarap ay Pilipinas, sa mundo'y walang katulad. Kagawaran ng kalusugan, gabay namin kahit saan. Lagi namin gagampanan ang tungkuling sinumpaan. Laan sa'yo maging ang buhay upang tayo'y magtagumpay sa pagbuo ng iisang bansa na matatag at malaya.
Let us take a trip down memory lane as we watch this tribute video for the graduates.
One day the world all came to a stop. Without any warning, it all freeze. Spring, it didn't know it had to wait. Showed up without any delay. Footprints on the pavement fade away, and I'm here waiting to start again. Time goes on, moving alone, without an apology. It looks like it is gonna rain today. I am drowning out inside. The rain will still not go away. Trying to run away, can't escape the clouds. I thought that I was enough, too human to live without love. We're in a world of pain, trapped by the world going insane, making me press rewind on all the things I've been watching. Dancing alone, half beating a world of my own. When the winter comes again, let's breathe together. There is no end in sight. Will we ever see the light? My feet are frozen in time, oh. Close your eyes for a moment. Take my hand, let's move forward to a brighter morning. Get going like an echo in the forest. We will move on, dawn is coming, as if nothing ever happened. Yeah, life goes on like an arrow in the blue sky. Another day goes flying by. On my pillow, on my table. Yeah, life goes on like this again. Let me tell you how I'm feeling, wrote it in a song. People say the world has changed, but they all got it wrong. I know that nothing changed between you and me, no it ain't changed. We'll greet each other like we never said goodbye. Not waiting for tomorrow, it's all tonight. Stopping for a while, but do not hide away, cause we will soon reunite. There is no end in sight. Will we ever see the light? My feet are frozen in time, oh. Close your eyes for a moment. Take my hand, let's move forward to a brighter morning. Get going. Like an echo in the forest, we will move on. Dawn is coming, as if nothing ever happened. Yeah, life goes on like an arrow in the blue sky. Another day goes flying by. On my pillow, on my table. Yeah, life goes on like this again. I remember. Yeah, yeah, yeah. I remember, I remember, yeah, I remember, yeah, life goes on like an arrow in the blue sky. Another day goes flying by. On my pillow, on my table. Life goes on like this again. Let me tell you how I'm feeling, wrote it in a song. People say the world has changed, but they all got it wrong. I know that nothing changed between you and me, no it ain't changed. We'll greet each other like we never said goodbye. Not waiting for tomorrow, it's all tonight. Stopping for a while, but do not hide away, cause we will soon reunite. There is no end in sight. Will we ever see the light? My feet are frozen in time, oh. Close your eyes for a moment. Take my hand, let's move forward to a brighter morning. Get going. Like like an echo in the forest. We will move on, dawn is coming, as if nothing ever happened. Yeah, life goes on like an arrow in the blue sky. Now the day goes flying by on my pillow, on my table. Yeah, life goes on like this again. I'll remember. Yeah, yeah, yeah. I'll remember. I'll remember. Yeah, 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 yeah. I'll remember.
That culminates the first ever virtual graduation ceremonies of the residency training graduates of the Northern Mindanao Medical Center of Batch 2020. We thank everyone for the success of this momentous endeavor. Thank you everyone, and may God bless us all.